Welcome to Baylor Scott & White's Enhanced Recovery After Surgery program. Our goal for this program is to make your stay a comfortable experience and provide you with goals and education to support your surgical recovery. We know that our patients do best when we help them understand what to expect and include them as an active member of our patient care team. Throughout this class, we will teach you what to expect and will also encourage you to move your own care forward while working towards the goals that will be covered throughout this class. If you have a person who you've identified as a support person for your recovery, you may want to invite them to watch this video with you.
ERAS stands for Enhanced Recovery After Surgery. It's made up of evidence-based practices that are proven to help you recover faster, minimize complications, and improve your overall outcome of surgery. We have some core principles focused on effective pain management, early return of bowel function, decreased anxiety, decreased risk of infection, and decreased time spent in the hospital. The core principles include patient optimization, patient education, early mobilization, and decreased volume of narcotics for pain control.
Getting prepared.
Part of enhanced recovery after surgery is preparing your body for your upcoming procedure. It is important to be physically, nutritionally, and mentally prepared. In order to keep yourself in good physical condition, it's important to stay active leading up to surgery. Walking is one of the easiest ways to be active. Nutritionally, prepare yourself by eating lean protein, fruits, and vegetables. Some examples of lean proteins are skinless chicken breasts, lean ground beef, salmon, tuna, non-fat Greek yogurt, and egg whites. Also, drinking 6 to 8 glasses of non-caffeinated fluids such as water will help you stay hydrated. Please let your surgeon or surgeon's clinic know if you're eating less than usual. Mental preparation is also important, so you'll have a dedicated team who guides, supports, and answers any questions that you may have. Starting today, optimizing your health. Make a list of all medications that you are taking, including prescription medications, over-the-counter medicines, herbal medicines, and vitamins. Please list the name, the dose, how often and when you take each medication. Make sure to bring this list with you to the hospital so that we can continue giving you your medications after surgery. Using tobacco or nicotine products such as dipping, vaping, smoking regular or electronic cigarettes can delay wound healing and increase your chances of having complications. If you need help quitting, please call 1-800-QUIT-NOW. Drinking alcohol can cause dehydration. Avoid drinking alcohol at least the day before surgery. You may have received a prescription from your surgeon for a prep kit with specific instructions to follow. Depending on the type of surgery you're having, there may be a bowel prep in this kit. Additionally, the kit ordered for you will be customized to your specific surgery and health needs. If your surgeon has instructed you to perform a bowel prep, there will be written instructions on how to complete the prep. It will include when to start the prep and how to complete it. Follow your clinic's instructions. Your surgeon will usually want you to eat a light breakfast the day before surgery and start drinking clear liquids at noon. Additionally, you will be allowed to continue to drink clear liquids up until 2 hours prior to surgery. If you don't need to complete a bowel prep, you may eat light meals and then switch to clear liquids 6 hours before surgery. Hydration is key. You'll need to stop drinking 2 hours before your scheduled surgery time. The goal in both scenarios is to hydrate your body well before surgery. Your surgeon may instruct you to consume a clear liquid diet up to 2 hours prior to surgery. Make sure you follow the directions provided by your surgeon's clinic. A clear liquid diet includes the following: fat-free broth, such as fat-free chicken, vegetable, or beef broth, Jell-O without fruit, popsicles without fruit or cream, black coffee or tea with no milk or creamer, apple juice, water, sports drinks like Gatorade, and a special surgery drink if prescribed. With each of our kits, you'll receive a special soap designed to remove skin bacteria and prevent infection. This soap is called chlorhexidine gluconate, and you'll shower with it the night before and the morning of surgery. You can wash your hair with your normal shampoo and conditioner, then apply the soap from the neck down, avoiding your genital area, focusing on where you're having your surgery. Leave the soap on your skin for about 1 to 3 minutes before rinsing it off. Make sure to use a clean towel to dry off and sleep on clean sheets and in clean pajamas. If your pets normally get into your bed, make sure that they don't get back in after you've changed the sheets. You don't want to apply any lotions, deodorants, or perfumes. Avoid using a razor to shave your skin the day before or the day of surgery, as it may cause nicks in the skin that can be opportunities for infection. We ask that you shower with chlorhexidine the night before and the morning of surgery. If your surgeon did not order a prep kit from our pharmacy, you can pick up chlorhexidine gluconate soap at any drugstore or pharmacy. It's typically found in the first aid aisle. Your surgeon may instruct you to consume a clear liquid diet up to 2 hours prior to surgery. Make sure you follow the directions provided by your surgeon's clinic. A clear liquid diet includes the following: fat-free broth, such as fat-free chicken, vegetable, or beef broth, Jell-O without fruit, popsicles without fruit or cream, black coffee or tea with no milk or creamer, apple juice, water, sports drinks like Gatorade, and a special surgery drink if prescribed. Planning ahead for your return home. Our goal is to get you home where you can move around and feel more comfortable. Before your surgery day, identify a support person who can drive you home and assist you as you continue your recovery. You may have some lifting restrictions that limit your ability to perform household chores, such as carrying in groceries or lifting a large bag of dog food. If you're the main cook in your family, you may want to plan a few easy meals ahead or prepare freezer meals. Clear walking paths in your home to reduce the risk of falls, such as removing rugs, uneven surfaces, or unused household items. If you're not feeling well before your surgery and have a fever, cold, rash, or other health concerns, please call your surgeon's clinic as soon as possible so we can have the best plan in place for your well-being.
What to expect at the hospital.
What to expect in pre-op. On the day of surgery, you'll come to the hospital and check in. Our hospital team will take you to the pre-op holding area. Make sure to bring your medication list. Your pre-op nurse will review your medications from this list and review your health history. Before surgery, you'll talk with your pre-op nurse, your operating room nurse, your anesthesia provider, and your surgeon. This is a good time to ask any additional questions that you may have. At that point, we'll also sign consent forms if you've not previously signed them. You'll change into a hospital gown and remove all jewelry and undergarments. Because of this, it's a good idea to leave all jewelry at home. You'll have an IV placed, and you may be given some medications to take. After that, we'll take you back to the operating room. Post-op day of surgery. After surgery, you'll be brought to a recovery area. We sometimes call this area the PACU. Your surgeon will update your support person to let them know how you're doing. Once you're ready and a bed is available, you'll go to the post-surgery floor or home, depending on your plan. After surgery, you're encouraged to take deep breaths and cough. You may be instructed to use a device called an incentive spirometer to assist you in taking deep breaths. Once you're on the post-surgery floor, remember to use your surgery guide brochure to know what to expect. One of the best things that you can do to improve your recovery is to get moving and start walking as directed by your care team. To ensure your safety, your care team will help you get out of bed the first time. Movement goals for the day of surgery may include sitting on the side of the bed, standing, walking, and having your meals sitting up in a chair. The day after surgery, your goal is generally to walk 4 to 6 times a day and continue eating all your meals in the chair. The more that you do, the better. Each day, you'll progress and tolerate more activity. Early mobility improves recovery because it wakes up your organs from anesthesia, helps your bowel function return, prevents blood clots, and helps get oxygen flowing through your blood, reducing the risk of pneumonia significantly. Mobility helps you heal faster and with fewer complications. Remember, once you leave the hospital, it's important to increase your activity daily and spend most of your day out of bed. Pain management is an important part of your recovery. Our goal is to reduce your pain to a tolerable level that will help you remain functional and be an active participant in your own care. The goal is not to be pain-free. After surgery, you will have some discomfort. However, the expectation is to be comfortable enough to walk in the hallways and take an active role in your recovery without being drowsy. In this program, we use various methods of pain management as indicated, rather than simply administering opioids or narcotic pain medication. You may receive a regional block or epidural. Regional or epidural anesthesia makes a specific part of the body numb to relieve pain or to allow for the surgical procedure to be done with less discomfort. The best option for you and your pain management will be discussed between you and your anesthesia provider and surgeon. Other ways that we help manage your pain is using non-opioid pain medications such as Tylenol and Motrin. Often, additional non-opioid medications that treat different types of pain will be given with the goal of decreasing opioid requirements. We found that using this type of pain management plan helps our patients feel more comfortable. Preventing complications. There are ways that you can prevent complications after surgery. Washing your hands with soap and water or hand sanitizer can help prevent infection. Remind visitors to wash their hands as well. Keeping clean hands and a clean environment helps reduce the chances of postoperative infection. Keep your incision site clean and dry. If you have guests who are not feeling well, ask them not to visit while you are recovering. Your surgeon may order an incentive spirometer, which is a plastic device that can help prevent pneumonia when you breathe in. If your surgeon asks you to use this device, it's a good idea to use it 10 breaths every hour while you're awake. Again, walking is key. Walking is a great way to prevent many complications. Remember to get moving.
Goals for discharge. We know that our patients recover best in their own environment. You'll be discharged once you reach your goals. Most of our gynecology patients leave the hospital the day of surgery or stay 1 to 2 days after surgery. It's important for gynecology patients to be able to urinate on their own before leaving the hospital. We may want to see some return of bowel function, whether that be passing gas, having a bowel movement, or having active bowel sounds. We want to make sure that you're able to walk 4 to 6 times a day, that you're tolerating liquids and staying hydrated. We also want to make sure that you can tolerate solid foods without being nauseated, and that your pain is at a comfortable level without requiring the use of IV pain medication. What to expect when you go home. After surgery, it's normal to bleed or have spotting any time during the first 3 weeks after surgery. It should not be enough to soak a pad in an hour. Do not soak in the bathtub or get into the pool for at least 2 weeks. Avoid putting anything in your vagina until your healthcare provider says it's okay. You'll get additional instructions at the time of your discharge, including information on how to contact your provider with any questions or concerns after your discharge. Your surgery guide has great content to help you prepare for surgery, goals for discharge, and a section that lets you know what to expect when you go home. There's also a section to let you know when to call your surgeon's clinic.
Please review your surgery guide and all additional discharge instructions so you know what to expect.
If you have any questions about enhanced recovery after surgery, please reach out to fill out our form at bswhealth.com/ERAS.